All right, team, let's focus. The patient presents with symptoms of simple clinical colitis activity index, colitis, and periodic fever syndrome. What's our diagnosis?
I'm leaning towards Crohn's disease based on those symptoms.
I think it could be familial Mediterranean fever. The periodic fever suggests it.
I disagree. I'm thinking more along the lines of ulcerative colitis.
I believe it might be a case of chronic multifocal Langerhans cell histiocytosis, considering the overall picture.
Damn it, Frank is right. It's chronic multifocal Langerhans cell histiocytosis. We need to act fast.
Are you sure about this, Hawks? It's a risky procedure.
It's a drastic measure, but if it's the right treatment, we have to trust Hawks's judgment.
Let's prep the patient for surgery. We have to save their life.
I'll start preparing the ore. This is risky, but it's our best shot.
No time to waste. Let's do this. Lives are on the line. Tracy, thank you for seeing me. I believe my patient has chronic multifocal Langerhans cell histiocytosis, and I want to perform a hemipelvectomy to treat it.
Hawks, are you sure that extreme measure is necessary? Have you considered all other options?
Of course I have, Tracy. I have years of experience in this field, and I know what's best for my patient.
I understand that, Hawks, but let's not forget your track record. You have been wrong before, and we can't afford to make a mistake like this.
Don't you dare question my expertise, Tracy. I know what I'm doing and I stand by my diagnosis. Trust me on this.
I trust you, Hawks, but I also have a responsibility to ensure the best care for our patients. Let's discuss this further before making a final decision.
Fine, let's discuss it further. But mark my words, Tracy. I am confident in my diagnosis and treatment plan.
Leslie, I just checked on the patient and it's not looking good. They're in critical condition after the hemipelvectomy.
Oh no, that's terrible to hear. What can we do to stabilize them?
We need to inform Hawks that the hemipelvectomy was not the correct treatment for chronic multifocal Langerhans cell histiocytosis. We might need to explore other options quickly.
I understand your concern, Frank, but right now our priority should be the patient's well-being. Let's focus on stabilizing them first before worrying about how to break the news to Hawks.
You incompetent fools. How could you have chosen the wrong hemipelvectomy and misdiagnosed the patient? You almost killed them.
I disagree. I think the patient presented symptoms that clearly indicated a different condition.
I believe we made the best decision based on the information we had at the time. It's not our fault if the outcome wasn't what we expected.
I still think we need to revisit the initial tests and see if we missed something crucial.
I don't think any of us expected this outcome, but maybe we can learn from this experience and improve our diagnostic skills moving forward.
You call yourselves diagnosticians. You're a disgrace to the medical profession. I'll handle this case myself from now on. Don't bother coming near this patient again. You're all a danger to their health. So, Johnson, how's life outside the hospital treating you?
Pretty good, actually. I've been spending more time with my family, trying to enjoy the little things.
That's nice to hear. Family is important.
Yeah, it brings a good balance to the long hours we put in here. What about you, Hawks?
Oh, you know, same old. Just trying to crack this complicated case I've been working on.
Always the dedicated doctor, huh? What's the case about?
It's a rare condition, but I think I've finally figured it out.
Really? That's great news. What is it?
Sorry, Johnson. Gotta go. I need to check on my patient. Catch you later.
Wait, what? You can't just leave me hanging like that.
Sorry I'm late, but we have a critical situation here. We need to act fast.
Hawks, you can't just barge in here without proper gear. You're putting everyone at risk.
Seriously, this is unacceptable. We have protocols for a reason.
Hawks, what's going on? Why are you so reckless?
I know I may have upset you all, but we've been looking at this all wrong. It's not chronic multifocal Langerhans cell histiocytosis.
Then what is it, Hawks? What's your new diagnosis?
The patient is suffering from lethal arthrogryposis with anterior horn cell disease. And the prognosis is not good.
What do you mean, Hawks? How bad is it?
It's terminal. The patient doesn't have much time left. Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks. That was a close call.
If I didn't have such idiotic doctors to work with, we wouldn't have been in this mess.
What do you mean? You were the one who declared the wrong diagnosis.
Well, maybe my diagnostics team should take some responsibility too.
Hawks, that's not fair. You made the final call.
I need some air. I'm out of here.
Hawks, we need to talk about this.